So all that is also very important beyond trusting on what the security is doing. So I feel that much need to be done on the area of security and social work in terms of counseling and confidence building for the community people and those in the IDP.
Now Faraja, you're a nutritionist and you're talking about food for these children. What do you think that the federal government and the state governments, you know, the various governments in those areas, where do you think that their focus should be so that the food being donated will reach the children?
I think for the time being there are coordination mechanisms between government and partners that are working in to respond to the humanitarian situation in Northeast, especially Borno. What needs to be done, I think, is to strengthen those coordination mechanisms and ensure that those that are in need are being reached and they receive the support that comes from the government and any other partners.
There are a number of NGOs on ground there who give us reports from time to time as to what is going on there. Do you think they're going about this the right way?
There is coordination mechanisms. Each sector has a coordination mechanism in terms of having a coordination leader. For example, for nutrition, is the state government that is the coordination lead. So normally they should, and they have to, the data they provide comes from the sector and from the state ministry and not their own. The reporting systems are through the structures, the management information structures, and they derive information from those structures.
Well, do we have a record really about how many children are we actually talking about? What's the extent? I mean, are they millions or thousands? And do they have, abodes spread all over these areas, or they are just in one place?
I think there's a lot of migration, so the children are in most areas that are more secure together with their families. So the numbers, they may vary from one place to another because of that migration. But in terms of the population that is accessible, the data is available. And it is available through the government structures. The data that is being utilized is through the population data that was from the census. It's been extrapolated by every year. So the data that is available is not from each individual organization, but the gate is from the statistics information that is available within the states.
Let me just ask you this question. You're a nutritionist, but how are you connected with all of this?
Yes, as I mentioned before, all malnutrition has multiple causes, and most of it, if you look at it, if it's food food intake is linked with food accessibility, is linked with agriculture. But not only agriculture, it links also with the microfinance and microeconomics. So you have to make sure that you understand all this situation and you link with all the people, necessary people that are involved in the agriculture, food security, and social safety net. On the other hand, also malnutrition is not caused only by food, but also the other issues of care. So you have the social component of it and gender. And then there is the component of health, which has to do with the hygiene and access to facilities. So you have to make sure also you link with the health people, with the people in the health sector and also in the water and sanitation sector. Especially if you have to treat acute malnutrition, you have to do it through the health facilities. So you have to make sure that there is a link or you work together with the health sector.
From your assessment, this problem can be solved if all the agencies and government involved come together and all the efforts are well coordinated and mastered. This can be sorted out?
Yes, I believe if all efforts are put together, well coordinated, and make sure that we identify and provide the services to those that are in need, we should be able to solve this problem.
Okay. Well, Doc was mentioning earlier on the process of psychological rehabilitation for some of these people who be suffering from, post-traumatic stress disorders and so on, rehabilitating. This is Christmas period. What are you doing in this regard to lift up the children's spirits a little?
Yeah, within, we work together also with the child protection sector. They're the ones who make sure that they identify the children that are in need of psychosocial support, the children that are in need of care, in terms if they don't have caretakers with them, those that are being oppressed or any other forms of child protection issues. They work together with the child protection or social welfare people to ensure that they provide them with the environment that is appropriate for the children in terms of their growth, in terms of their happiness and their well-being.
Okay. Now, Doc, we need to take your last word on this now. Doctor?
Well, the situation is unfortunate. It has happened and it's still happening. What is important is that we should increase our energy towards bringing this to an end. Nigeria should learn that we need to really not allow things deteriorate to this level. I hope in earnest the condition of these children will be improved. The Northeast will be rebuilt as committee of presidency has been set up, and we urge them to do things in a quicker dimension so that these solutions will be delivered in earnest.
Thank you very much.
Thank you very much, Doc.
And we hope that as Christmas approaches,
Yes.
because Christmas really is a season for children, we hope that things will improve such that these children will smile and these figures that you have given us will just be figures, just remain figures.
We need some brave Nigerians to go out there and give those children a little, jolly good Christmas.
Share them up.
Yes,
Thank you very much,
Thank you, Doc.
Faraja Chiwile, who's a nutritionist, and Dr. Aloifona Ekenechukwu, who is Head Technical Operations Office of Social Affairs and Health of the African Union. Thank you very much for joining us this morning.
Thank you for joining us, nutritionist. Thank you.
Sunrise will return in just a moment. Make sure you're there.